You know, when we think about diabetes care, as we've discussed earlier, there's a lot of comorbidities, lifestyle management, diet, exercise, multiple therapies involved, chronic disease. It seems like it takes a village to take care of a person with type 2 diabetes. What are some of the other actors in this play of care team members that might play a really important role in taking care of a diabetic patient?
Yeah, I mean, I could go first. For us, where, like I said, I'm sitting in the endocrine service, and our follow-up is around 3 to 4 months after we see them. And so the endocrinologists rely on a huge slew of folks on the back end to making sure that within those 3 to 4 months, a lot of stuff happens. There's a referral to a pharmacist, or a referral to nutrition, and maybe they go get their eyes checked, go to a podiatrist, making sure all of our immunizations happen through nursing and not through pharmacy, and so making sure that they go and get their appropriate immunizations. So there's a lot of players. If we think about general health maintenance and routine things that are involved with diabetes care, there's a lot of folks that need to kind of connect that dot. And I feel
So we have physicians,
Yep.
pharmacists. What are the other actors or other types of activity?
Dietitians,
Dietitians,
nurses,
nurses.
podiatry.
And I've had great response and help from the clinical psychologists that we have in our clinic. I mean, we're blessed to have that service in the primary care clinic. And it's been, it's overwhelming for these patients, whether it be at new diagnosis or just as the disease states progress, because it's life going on with them. And so, finding out what some of their barriers are to either certain therapies or just trying to figure out, we've talked about this, he understands it or she understands it, what is the reason that we're not moving forward? And so those clinical psychologists really can help to get in there to identify it, and then they can work with cognitive behavioral aspects to make sure that we can try to work together all as a team.
Actually,
Social
one of-
workers, health coaches.
I was going to say,
doing
one
this
of
a
the
lot.
biggest healthcare professionals actually seeing or identifying diabetes first right now are dentists, because people are more routine in going to see their dentist than they might go to see their doctor. And so actually many dental offices are now actually doing diabetes screenings and catching people with diabetes to refer. The other thing too, audiology. I mean, right now there's a big push with the audiology project, because if we think about it, hearing loss, it has to do with the microvascular disease. So people are often, already experiencing hearing loss and they don't even know they have diabetes. So looking at, all of this, but then we also have to look at the patient and what are they doing. This is a lot of stress. Jess, you mentioned about how overwhelming this can be. What is the patient doing coping-wise? And there's actually been studies that looked at yoga and Tai Chi at reducing A1C levels because of your breathing, your relaxation, so again, the coping mechanisms. So I think we have to look at it more than just the healthcare providers, but our partners, our community partners. So are they, working with a massage therapist or again, a yoga instructor? We see a lot of people that struggle. One of the things we do, we go into food pantries to actually try to help people that are struggling through this and allow them the education services that they need. And I think that's where we come in. We're CDEs, Certified Diabetes Educators, and so we know the process of how to educate the patient. Because if we think about it, how many times prescribers will tell a patient, do this, but what percent of patients really follow through?
Or understand what this is.
Exactly.
Right?
So I think that's where, again, teaching the patient to solve their own problems and manage their condition is, as a CDE, that is our job, to work with these patients to, again, help them better control their condition.